This is AI and the Future of Healthcare, written by Eric Mahajan and Parag Topol, narrated by Josh Wellington. Chapter 1. AI's Humble Healthcare Beginnings, the Origins of AI in Medicine. The idea of using artificial intelligence in healthcare first emerged in the 1950s, alongside early work in expert systems and medical diagnosis. In 1957, Herbert Simon and Alan Newell designed the General Problem Solver, one of the first AI systems aimed at replicating human problem-solving skills. Their work illustrated the possibilities of an automated approach to complex cognitive tasks like medical decision-making. In the 1960s, much AI research focused on modeling sections of clinical reasoning and medical knowledge. For example, the Dendril project at Stanford University applied natural language processing to analyze chemical compounds. This system helped organic chemists determine the molecular structure of unknown materials. While limited in scope, it demonstrated AI's potential to automate specialized scientific tasks normally requiring human expertise. The MySyn and Internist I programs, developed in the 1970s, more directly addressed clinical applications. MySyn focused on diagnosing bacterial infections using a rule-based approach. It prompted users for patient symptoms and lab results, then recommended antibiotics and dosages. Internist I similarly diagnosed complex illnesses through Bayesian networks and heuristic reasoning. These systems marked major progress in encoding medical logic into AI programs. However, they were confined to narrow domains and lacked common sense reasoning. The rise of expert systems. In the 1980s and 90s, AI research shifted toward expert systems, AI programs encoding the knowledge and analytical steps of human specialists. These systems aim to provide domain-specific advice by emulating the reasoning of experts. Medicine, with its reliance on specialized knowledge and deductive diagnosis, was a natural application area. Two major expert systems, Internist I and QMR, demonstrated expanding capabilities. Internist I, developed by Jack Myers in the 1980s, incorporated a large knowledge base of disease manifestations and relationships. It highlighted clinical features of a case that were most important for differential diagnosis. QMR, created in the late 1980s by Edward Shortleafy, gave recommendations for the treatment of over 600 disorders. It combined rules, semantic networks, and probabilistic representations in an innovative hybrid approach. These systems overcame prior limitations in medical AI. Their large knowledge bases, made with contributions of dozens of specialists, exceeded the expertise of any single human. Their reasoning techniques became more sophisticated and flexible through combining approaches. However, computing resources.
Sample complete. Ready to continue?